The center was founded on a simple premise. There is no way to tell a compelling story without data. Millions of people didn't have health insurance. Millions were and are suffering from chronic conditions such as diabetes and obesity. And millions still do not have access to quality care simply because they are poor or because they don't speak English well. These voices and these issues were getting lost because there were no numbers to prove how widespread and how severe these problems were. 20 years ago, the UCLA Center for Health Policy Research stepped in to fill this gap.
I think it's fair to say that the work that the center has done on health insurance alone made a substantial contribution to the passage of the Affordable Care Act. The center has made major contributions to our understanding of the link between soda and childhood obesity. The center has made major contributions to our understanding of the barriers to care in vulnerable populations and vulnerable communities. And the center has made extraordinary contributions to our understanding of the powerful link between poverty and health status. I can't think of too many other organizations that have contributed more to our basic understanding of health in California and across the nation.
Air pollution is killing our community, but we didn't have the data to prove it. We partnered with the center to get training and meet scientists that could give us the evidence we needed. The center helped us to make our case for change.
Data is power. It gives credibility. And I think that's what Rick realized from the start. E. Richard Brown was the center's founding director and one of California's foremost health policy scholars and advocates. Rick had the vision to create CHIS, the California Health Interview Survey. Today, CHIS is the nation's largest state health survey. Our data is valued not just because it's big and comprehensive, but also for its rich ethnic diversity, which tells an even bigger story about our changing nation. And because Rick believed in putting user-friendly data into the hands of everyone, not just the experts, our data has been downloaded more than 1 million times.
CHIS is an incredible tool for policymakers. Both the talented center's researchers and students comprise an invaluable brain trust for public health. Part of the center's mission is to train the next generation of health policy researchers and advocates. Hundreds of public health professionals doing essential work on the most pressing health issues of our time got their start at the UCLA Center for Health Policy Research.
Working here helps me make the connection between the theory we learn in school and the real problems people face. It's been an incredible experience to work here at the center.
The center is about impact. It's about telling a story using data and analysis that helps make positive, practical change. Whether through our Policy Brief series, which boils down the big issues into clear, concise language, or through our work with the media, the center has become incredibly effective in raising awareness about some of the most critical health issues facing our nation.
I think all public health leaders rely upon the center's research, data, and analysis. They know that the numbers support the reports and the legislation that justify the programs and the services that help millions of Californians. The numbers are the foundation of everything. They create the change, and the center is critical to those efforts.
What can we achieve in the next 20 years? I hope we can contribute to true universal health coverage in this country. I hope we can have an even greater impact in the fight against chronic disease. And I hope we can focus even greater attention on the racial and ethnic and sexual minority groups who have been left out and stigmatized for too long. We can't do it alone. We rely not only on your support, but on your passion to be part of the great healthcare debates of the next 20 years. Together, we can turn these hopes into reality.